Welcome to Ellie Scrubs In. This is part 1 of our surgical instrument guide, created especially for medical students, scrub tech trainees, and new residents learning the ropes in the operating room. In this video, we'll go over 10 essential general surgery instruments, what they're called, what they're used for, and key tips to avoid common mistakes. Let's get started. Number 10 Scalpel. The number 10 scalpel blade is one of the most recognizable tools in surgery. It's a large, curved blade that attaches to a number 3 handle and is used primarily for making large, clean skin incisions. Its curved shape allows for a smooth, sweeping cut, which is especially important when opening the abdomen or making long incisions along tissue planes. To use it properly, hold the handle like a dinner knife and apply even pressure with your index finger. Use your opposite hand to provide counter traction when needed. This improves accuracy and depth control. A common pitfall for beginners is cutting too deep or too tentatively. Remember, the skin doesn't require much pressure to incise cleanly, and sawing motions lead to jagged edges. Cut with the belly of the blade, not the tip. Always change blades when they start to dull, even mid-case. A sharp scalpel reduces tissue trauma and improves wound healing. Dispose of blades safely using a needle box or blade remover. Never use your fingers. Metzenbaum scissors. Metzenbaum scissors are long, slender scissors with a blunt tip, used for cutting delicate tissues like fascia, peritoneum, and soft tissue layers. They come in different lengths, but the classic version is curved and fits easily into most general surgery setups. What makes Metzenbaums unique is their design. They're optimized for sharp dissection without crushing. You'll use them during bowel resections, hernia repairs, and abdominal wall closures. The key to using them well is to cut with the tips, not the belly of the blade. They're not meant for cutting sutures or heavy tissue. That's a job for Mayo scissors. A common mistake is misusing Metzenbaums to dissect tough or fibrous structures. This wears out the blade and increases your risk of injury to surrounding tissues. Always keep a clean dissection plane and use a spreading motion when you're teasing apart layers. If you're ever unsure whether scissors are Metzenbaums or Mayos, remember, Metzenbaums are longer and more delicate. Use them only for what they're designed to do: gentle, controlled dissection. Mayo scissors. Mayo scissors are heavy-duty scissors designed for cutting dense tissues like fascia and muscle. They come in both straight and curved varieties. Straight Mayo scissors are often used to cut sutures or tough materials, while curved Mayos are more often used in tissue dissection. They have a strong build and a blunter tip compared to Metzenbaums. You'll often encounter them during midline abdominal entry or closure, when cutting through thick fascia or aponeurosis. They're also a go-to tool when trimming hernia sacs or dense adhesions. A good surgical technique involves cutting with confidence, don't nibble. Use a steady, firm motion with the tips fully engaged. One mistake learners often make is trying to use Mayo scissors inappropriately on soft tissue. This can lead to unnecessary trauma and poor precision. Pearl. When in doubt, ask yourself, is the tissue dense enough to justify the Mayo? If not, go for something more delicate, and always keep your Mayo scissors away from your scrub tech's suture scissors. They're not interchangeable. Kelly clamp. The Kelly clamp is a classic curved hemostat used to clamp vessels and manipulate soft tissue. It's larger than a Mosquito clamp and features transverse serrations that extend about 2/3 of the way down the jaw, allowing you to grasp tissue without fully crushing it. In general surgery, the Kelly is your workhorse for controlling moderate bleeding, tagging vessels, or creating a window in tissues. You might use it to clamp the edges of fascia, or to gently dissect in blunt fashion by opening and spreading the jaws in tissue planes. Pearl. The Kelly clamp can serve as a conduit for passing ties or a sponge stick into deep spaces. A common mistake is overclamping, especially around delicate or inflamed tissue. If you clamp too tightly, the tip can crush small arteries or tear fragile structures. Pitfall. Don't confuse Kelly with cockers. Cocker clamps have teeth and are designed to hold on to tougher structures. Kellys are gentler and better suited for general dissection and clamping. Mosquito clamp. The Mosquito clamp is a small, fine-tipped hemostat used to clamp tiny vessels or perform delicate dissection. It's especially useful during thyroidectomy, pediatric surgery, or any procedure with a narrow field and fine structures. Its narrow tip allows for precise application, which is helpful when you're dissecting around nerves or small vessels. Mosquitoes have transverse serrations that extend all the way down the jaw, helping hold even very slippery tissue, like bleeding venules or small lymphatics. Pearl. The mosquito is ideal for building a meticulous dissection plane when the margin of error is small. Pitfall. Using it on tissue that's too dense will cause the jaws to misalign or lose grip. It's not built for strength. Treat your mosquito clamps gently. They'll serve you well in return. Adson forceps. Adson forceps are toothed, thumb-operated forceps used primarily for manipulating skin and fascia. They're a staple of closure, helping surgeons approximate tissue while suturing. The teeth provide a strong grip on tissue without crushing it. Use them during skin closure to grasp the dermis and bring edges together cleanly. They're also used to hold suture tails or manipulate suture needles. They should be held the same way a pencil or pen is held when writing. Pearl. When using Adsons, grasp just enough tissue to control movement without bruising the skin. Avoid pulling upward too forcefully. Skin tears are easy to cause and harder to fix. Pitfall. Don't use Adsons on bowel, peritoneum, or vasculature. The teeth are too aggressive and can cause microtrauma or tearing. Allis clamp. The Allis clamp is a toothed, locking clamp used to grasp and manipulate tough tissue. Its multiple small teeth interlock tightly, making it ideal for holding structures like fascia, muscle, or even tumors during resection. In hernia repairs, it's often used to hold the hernia sac. In bowel surgery, it may help hold the mesentery or redundant tissue to provide retraction. Pitfall. It's not atraumatic. Never use Allis clamps on delicate structures like bowel or vessels. The teeth are too aggressive. Pearl. Allis clamps are great when you need a firm grip that won't slip. Just be sure you don't overuse them on fragile tissues. Babcock clamp. The Babcock is a smooth, fenestrated clamp designed to hold delicate, tubular structures like bowel, appendix, or ureters. Unlike Allis clamps, Babcocks are atraumatic. The jaws close with gentle pressure and cradle the tissue inside a circular opening. Pearl. This clamp is perfect for grasping the appendix or bowel loop without damaging the lumen. It gives the surgeon control and visualization without the trauma. Pitfall. While gentler than Allis, Babcocks still exert pressure. Don't leave them clamped on tissue too long without repositioning, especially during longer procedures. Army-Navy retractor. The Army-Navy retractor is a double-ended handheld retractor with two different blade lengths. It's used to retract skin, subcutaneous tissue, or superficial muscle during procedures like appendectomy or hernia repair. It's a basic but essential tool. Its low-profile design makes it easy to maneuver in tight spaces, and because it's handheld, the surgeon or assistant can adjust retraction dynamically. Pearl. Use it with moistened gauze between the blade and tissue to minimize trauma. Pitfall. Don't use it for heavy-duty exposure. For that, you'll need self-retaining retractors like a Balfour or Bookwalter. Richardson retractor. The Richardson, also called a Rich, is a deep tissue retractor used in open abdominal cases to hold back layers like fascia, muscle, and viscera. It features a right-angled blade with a curved handle for comfortable hand positioning. It comes in multiple blade sizes to suit the depth of exposure needed. You'll see it often in laparotomy, colectomy, or bowel resection. Pearl. Pad the blade to avoid nerve compression during long procedures, and rotate multiple retractors to reduce tissue fatigue. Pitfall. Don't lever aggressively. That can cause injury to the abdominal wall or underlying structures. That wraps up part 1 of our surgical instrument guide. Mastering these tools takes time, but knowing their names, uses, and risks is your first step to becoming confident in the OR. Like and subscribe for parts 2 through 5, and more surgical content on Ellie Scrubs In. See you in the next video.